I want to discuss one of the medications that often finds use in treating various forms of acne, and that's the use of oral antibiotics. So normally we use antibiotics to treat infections, but in acne management, acne specialists use antibiotics to block the inflammation that causes acne. So antibiotics can often have that extra effect. That is not necessarily curing an infection, but also blocking inflammation. So acne antibiotics often are very successful. But the thing to know is that it's not always the right time to use an antibiotic. And as a matter of fact, acne specialists are getting farther away from using antibiotics in acne management than they were just a few years ago. Now, a lot of patients have chronic acne, and that is, acne began to develop when they were a teenager, and it just continues to develop and cause problems. And patients are facing day-to-day breakouts. In this type of acne, it's always tempting for general dermatologists or pediatricians or other doctors to use an antibiotic because it's a fairly safe thing to do, and it's a fairly common practice to use. The problem with that is that in that scenario, antibiotics can have some help, but they're not always that effective, and they very rarely lead to complete clearing of their skin. And you can't keep a patient on an antibiotic for a very, very long period of time. So I think that there are better ways to use antibiotics in treating acne. And what we find at the Advanced Acne Institute, the best way to use an antibiotic is for situational acne. So, for example, if you have a college student taking final exams, that's a very stressful period of time, and those periods of time are associated with the release of different hormones inside the body, and those hormones can provoke acne breakouts. So we know that that period is very limited in scope because once the exams are over, the patient begins to de-stress and no longer is at risk of significant breakouts. So during that period of time, using antibiotics is a very good thing to do, managing significant acne breakouts. And we find very good success in that situation. Also, if there are life events that have become very stressful, also the use of antibiotics can be very powerful in those situations. But for somebody who is experiencing very long-term acne and they're really searching for a definitive option, oral antibiotics are usually not the best option to use. And there are various other options that we'll talk about in other videos.